principal diagnosis PDX versus secondary diagnosis SDX. In this video, let's clearly understand how to select principal and secondary diagnosis. This is one of the most important concepts in medical coding because correct sequencing directly affects claim accuracy and reimbursement. The principal diagnosis is the main reason for the patient's visit or admission. Secondary diagnoses are all other conditions that the patient has, especially those that affect treatment, management, or care. The most important step is to identify why the patient came to the hospital. That condition becomes the principal diagnosis. All other documented conditions are coded as secondary diagnoses. For example, a patient has both hypertension and diabetes. If the patient comes for treatment of hypertension, we code I10 first, followed by diabetes. If the visit is for diabetes management, then diabetes should be coded first, followed by hypertension. If the patient comes for treatment of both conditions and there is no clear reason mentioned, then we consider severity. For example, if a patient has both sepsis and UTI, sepsis is a systemic and more severe condition, so it should be coded as the principal diagnosis. Very important exception. The reason for visit always overrides severity. If the patient specifically comes for UTI treatment, even if sepsis is present, we should code UTI as the principal diagnosis because that is the reason for the visit. So always think clinically. Why did the patient come to the hospital? What condition is being treated? And what is the main focus of care at that moment? That will help you decide the principal diagnosis correctly. To summarize, principal diagnosis is based on the reason for visit. If the reason is not clear, then consider severity. But if the reason is clearly mentioned, it always overrides severity.